Good afternoon, students. So today I'll be discussing about an important opportunistic fungal pathogen, Candida. So all of us must be aware of this term candidiasis because candidiasis, it is mainly a fungal infection caused by the yeast Candida albicans. So why I call it as opportunistic infection? Because in a healthy individual, this fungus never produces any disease. But then when the individual becomes immunocompromised, and when the health and hygiene of the individual is not being maintained properly, that time this leads to the disease. And which area this fungus affects? It mainly affects the moist regions of the body, mainly mouth, vagina, skin, stomach, and urinary tract. And more than men, females are more commonly affected by this fungus. That is, it has been reported that more than 75% of the women, they get vaginal yeast infection during their lifetime. And there are, if you look at the different species of Candida that is known to cause the infection, in that the very important species is Candida albicans. Although more than 20 different species of Candida have been reported to produce the infection. So where do they live? So they usually live in the superficial and as well as mucoid region, and they mainly lead to infections like oral thrush and vaginitis, and sometimes through the bloodstream they can enter into our inner deeper organs and leading to potentially life-threatening diseases. So these are some pictorial representations of the candidiasis infection. This is an example of oral thrush. This is nail infection, everything. And there are basically two different etiological agents behind the candidiasis infection. One is Candida albicans, which is the most common cause, and Candida tropicalis, it is the rare cause. And if you see, just now I told you that is where is it where is it more prevalent? So it is more seen in 75% of females. And the occurrence of this fungus, it is worldwide, and it has only one reservoir, who is the human beings. And the mode of transition, so how people get infection, they get contact with secretions or excretions of mouth, skin, vagina, and feces, or from patients or carriers. And sometimes it can be even transmitted from mother to the newborn during childbirth. And if you look at the sign and symptoms, it is mainly characterized by minimal. So it starts with a minimal complications like redness, itching, and discomfort. But then when you don't treat it at the right time, it may lead to severe or even fatal infection. And in immunocompetent person, it is usually a localized infection, which means that it will not spread. But then when in immunocompromised individuals, it might spread to the other organs. And if you see, if you look at the uh, pharynx, like it can infect the oral cavity, the pharynx or esophagus, the gastrointestinal tract. Sometimes it can even go to the till the rectum and anal regions. An infection of the vagina, it is mainly characterized by severe itching, burning sensation, soreness, irritation, and a whitish discharge. And immunocompromised patients, what happens is that it can even go up to the esophagus, causing more serious condition called as candidemia. And in infants, it is mainly characterized by oral thrush. And what are the clinical symptoms behind this infection? It is mainly characterized by vulvar pruritus and characterized by vaginal discharge, and it is also characterized by a sore vulva due to itching. And this is more prevalent also in immunocompromised individuals, like patients with who have already HIV or AIDS, cancer treatment, then who are under steroid drugs. So such type of, and even diabetic patients, they are more prone to this Candida infection. And pregnancy and the usage of oral contraceptive also is reported to be the predominant risk factors. The same thing. And how to diagnose the disease? It is mainly by direct examination of the pseudohyphal cells from the tissue fluids. And the treatment, usually topical creams are applied, or else they can go for oral drugs like meconazole, or topical clotrimazole creams, or topical ketoconazole can be given. And prevention and control, it mainly depends on the cases, and it also mainly depends on the predisposing conditions of the patient. And how do you prevent the disease? A proper healthy diet would definitely prevent the disease, and then wearing appropriate underwears, and then it can also, and not wearing long wet clothes for a long period of time, and maintenance of proper oral hygiene. It mainly prevents the infection. Thank you.